Next up, we have Dr. Nour Akhras. Nour Akhras is a board-certified pediatric infectious disease physician who has been working at a freestanding women and children's hospital in the suburbs of Chicago for the last 8 years. Dr. Akhras also has another specialty. She was trained in traditional Islamic sciences in Damascus, Syria, and has her ijaza and tajweed through the late Sheikh Hassan al-Kurdi. May Allah shower him with mercy and elevate him. Dr. Nour Akhras has contributed a chapter on Islamic bioethics to a book published by Yale University entitled What's the Point? Clinical Reflections on Care That Seems Futile. She has served on the board of Iman, Inner City Muslim Action Network in Chicago, and chaired their youth group, Pillars, for many years. Dr. Akhras has participated in multiple medical missions to support Syrian refugees and displaced war victims in Yemen. She has served on the boards of the Syrian American Medical Society Midwest chapter and the organization Med Global. In 2012, she was awarded the Muslim Women Alliance's Inspiring Muslim Woman Award, and she is, for her work on the exploratory mission to the volatile Syrian-Turkish border. In 2019, she was awarded Med Global's Hero Award for her work on the NGO's maiden medical mission to Yemen. She has advocated for the rights of refugees through writing and speaking in various media channels, and she lives in Chicago with her husband and 4 children, mashallah. Dr. Akhras's talk is entitled The COVID-19 Pandemic, Focusing the Islamic Lens on the Microscope of the American Muslim Physician Experience.
Assalamu alaikum. My name is Nour Akhras, and I'm going to apologize in advance for maybe speaking too fast, but I'm going to try to slow it down. So I'm going to speak a little bit about not necessarily patient care or the experience from patient care perspective, because thankfully in pediatrics, the COVID-19 experience hasn't been as aggressive as we have seen in adults. But I'm going to speak about kind of my experience being an infectious disease physician prior to the introduction of the pandemic to the United States where I live. So I'm going to start back in January of this year, January 22nd to be exact. That day I went to the hospital where I work, and I had noticed there was a lot of security outside the hospital, which isn't normally there. And when I went in to see my patients, the charge nurse from our floor came up and told us that the second COVID-19 patient in the United States had just been admitted to our hospital. And the hospital administration was trying to keep that under wraps. And we were expecting to have the CDC come and investigate. And that's why there was so much security in the hospital. So back then, COVID-19 wasn't named COVID-19 even, and the World Health Organization had not declared a pandemic. But a few days after that, I received an email from the Med Global president. So Med Global is a medical NGO that serves refugees and people who are displaced from war. And at that time, I was on the board. I've since taken a leave of absence since because of the pandemic and my children being at home, e-learning, etc. So in any case, the email said, this looks like it's heading towards a pandemic. What should we do? What should our response be as a medical NGO? So some of the ideas we had at that time was to raise money for PPE for physicians and healthcare workers in developing nations. And another idea that we had was to prepare a training for healthcare workers in the Middle East and North Africa region for how to deal with patients in terms of isolation and precautions and protective equipment and treatment. So this is, again, late January now we're talking. And so I spent the next few days really researching everything that was out there from what was published from Chinese physicians and the World Health Organization. And one of the disturbing things I discovered was, first of all, the R0, which is the infectivity rate of the virus. And being infectious disease physician, that's really interesting to me, how infectious the virus was. And it wasn't as infectious as measles, for example, but definitely more infectious than influenza or other respiratory viruses that we know of. And then the second disturbing fact about COVID-19 was the long incubation period, which I'm sure we've heard about ad nauseum now, but back then we didn't know. That you could be infectious and not have any signs or symptoms of the virus. And so you're walking around in your community infecting people, not knowing you have the virus. So then I spent, that week putting together a manual for healthcare workers and sent it back to the board. And then I turned my focus to my local community. So I live in Chicago, and the masjid that I attend, which has an affiliated Islamic school, which my children attend, was planning a trip to Umrah for March, for spring break. So again, this is still, now we're talking February. The United States had not even recognized the pandemic. The World Health Organization had not declared it a pandemic. And so, but because I'd been researching and thinking about this virus for a while now, I started to panic a little bit about my congregation, or the people that attend the masjid, and the people that, the families that attend the school with my children, going to Umrah. And because I've gone to Umrah and I know how close people can get in those spaces, I started to think that probably is not a good idea. And I reached out to the masjid president. I actually texted him, and he doesn't really know me. I'm new to the community. I moved into this community about 5 years ago, although my husband's family, they're pillars of this community and were involved in opening the masjid and things like that. So I just texted him saying, I'm an infectious disease physician. And, he did know me, like his son was on my son's basketball team, but not intimately. So in any case, I texted him saying that I don't think that it's a good idea for the masjid to go on this trip. And because I'm worried about the novel coronavirus, that's what we had called it back then. And I think that it's probably a bad idea. I think that you should cancel. So he replied saying, we're looking into it. We're thinking about it. We're discussing it with the imam. And thank you for your advice. And so as a physician, I'm trained to always have a backup plan, because if my patient decompensates in the middle of the night, I want to know what I'm going to do and not have to think about it at 3 o'clock in the morning. So I had my backup plan in case they didn't cancel the trip. So then it's a few days after. Now it's February 29th of this year, and they hadn't canceled the trip. And I'm still reading the numbers and looking at what's coming out of Wuhan, China. And so then I decide that I'm just going to go to social media and post that I think going to Umrah at this time is wrong. So on February 29th, I posted on my social media that by then there was a few other cases in the United States. So after our second case in my hospital, there was a case in Oregon, there was a case in Washington State, and there was a case in California. And all of those cases had no epidemiologic connection, meaning those patients were not, they had not traveled, and they had not been exposed to a known person who had COVID. So I took to my social media and I said there is a there's a false sense of security here in the United States, thinking that COVID-19 isn't here because the numbers are so small. But that's only because we're not testing enough. And I had my own personal experience about testing. I had to fight a lot with the Department of Public Health in my own area to get my own patients tested for COVID because they didn't have an epidemiologic link. But the fact that these cases had shown up in Oregon and Washington State with no link meant that COVID was here and it was here to stay and it was in the community. So in any case, I wrote in my social media that I think it would be irresponsible for the Saudi government to allow Americans in for Umrah for this year, and it would be irresponsible for Muslim Americans to go. And at that time, I was not just worried that they would go to Mecca and interact with Umrah, people coming for Umrah from either China or other areas and bring back the virus, but then it had also become irresponsible because as Muslim Americans who maybe didn't know they could be transmitting the virus there and taking it and transmitting it to pilgrims who would transmit it back to their own countries who maybe hadn't had any COVID-19 in their country. So that was February 29th. And then I let that go, and I waited to see if my masjid board would close down their trip, and they didn't. So then, of course, I had a plan C because, I'm not paternalistic. The physicians in the older generation might be more paternalistic, but we weren't trained that way. But at the same time, I felt really strongly, going on the hadith that the Prophet ﷺ said, that whoever of you sees a munkar or something that's wrong or harmful, they should change it, if by their hand or by their tongue, if they can, or by their heart. That's the weakest of faith. So I felt really compelled that I need to stop this Umrah trip, at least for my local community. So then I took to emailing I used to have a teacher who was Saudi, who taught me Shafi'i fiqh when I was in my 20s, and he's a Saudi urban planner who lives in Saudi Arabia now and has connections to the government. So I emailed him saying, as you know, I'm an infectious disease physician, and at least for the United States, I can say that we know that SARS-CoV-2 is here, it's spreading in our community, and it would be irresponsible for the Saudi government to allow Muslim Americans to come to Umrah this year. So luckily, a few days after that, the World Health Organization did declare the pandemic. That was on March 2nd. And then 2 days after that, the Saudi government closed down Umrah for anybody that wasn't a Saudi national or living in Saudi Arabia or staying there. So the masjid board never had to make the decision. It was just made for them by the Saudi government. And then a few days after that, the United States declared that there was a national emergency due to the COVID-19 pandemic. And then after that, so the two weeks in March that came after that, I spent engaging in webinars, multiple webinars for the Muslim and non-Muslim community, about what to expect and how to proceed and how to protect ourselves, how to protect the vulnerable around us. And so, trying to balance putting the fear of God or putting the fear of this virus in people so that they would wear their masks and socially distance and wash their hands frequently and, try to protect the vulnerable around us. And at the same time, not instilling panic in the community, because the last thing we needed as healthcare workers was a state of panic where people would be coming to the emergency room, maybe not even having symptoms and already overwhelming a system that wasn't ready for 20% of the population to be hospitalized. So, drawing on the hadith of the Prophet ﷺ, that said, "Aqilha wa tawakkal," so meaning, you have to tie your camel or do your due diligence but then have faith in Allah subhanahu wa ta'ala that He'll protect you. Then soon after that, the next order of business that I had to tend to was that I was invited to the masjid board meeting, and they were discussing closing the communal prayers. So, and they had invited another physician, an ER physician, who actually had an opposing view to mine. And I argue that the communal prayer should be closed because, as we know in the Sharia, life takes precedence, or health takes precedence over other things, or over everything. So, and by nature, our communal prayers put us in a way that you could catch a respiratory virus very easily, especially SARS-CoV-2, by inhaling the droplets or the aerosol of the person standing close next to you. And so I argued that the communal prayer the masjid should close for communal prayers. And the other physician had argued that first of all, in our community, most of the people that were coming to the communal prayers were older than 60, and they were using the communal prayers as their only outlet for socializing. And that if we closed the masjid, another masjid would stay open, and those people would go there. But I argued that wouldn't be our masjid's responsibility, and that it was our masjid's responsibility to take care of their own, especially their own employees, and keeping the masjid open would put those people at risk, the employees, and ultimately, they thanked us for our opinions and didn't make a decision right away. But then a few days later, the government shut it down because the Illinois governor had closed everything that was more than 10 people. And so that made the decision for the masjid board easier to close down. I mentioned some other things in my paper, but I think I'm going to wrap it up here. And one of the questions that was posed to me was, what have we learned from this, or what has this experience taught us? And I think one of the things, especially as an American Muslim physician, we've spent the last 4 years in this country being demonized by our administration, and I'm not alone as an American Muslim physician who has spent the last 10 months or 9 months trying to protect the Muslim community and the community at large. And I think one of the lessons learned here is that that even though the government has been trying to demonize Muslims over the last four plus years, that we as Muslim American healthcare workers have really given our all to the community at large to try to protect from COVID-19 and save as many lives as we can. And I think the second lesson here too is that our Muslim community leaders really need to listen to experts in the field. And I know they do. I just felt like there might have been a slower response than I would have liked in terms of, the Umrah trip and even canceling the prayers. So in closing, I just hope that, as the numbers surge again in the United States, that we can take these lessons about being conscientious of our other community members, and just really, as Dr. Wa'il mentioned, stepping up and being aware of other community members and protecting ourselves and the others by keeping our masks on, and just looking at the light that's coming, inshallah, with these vaccines. Thank you.
Thank you so much, Dr. Nour Akhras. It's really interesting to see how much, at the bottom of having a responsible community lies or sits on the foundation of trust and relationships. And that's something that maybe we can talk about more. Who are the experts who community members are turning to, whose expertise might be ignored, whose expertise is embraced? as well as the issue of priorities within Islam. How do we have enough experience and discussions about how we take the different sectors in that deserve our attention and protection? For example, the maqasid al-sharia, the goals or the priorities of the sacred law, and how do we give them due attention in a crisis? Do we have enough experience? Do we have enough conversations about how we balance various priorities? So I hope that's something we can talk more about during the discussion period.